Good evening, everyone. Welcome to this final competency. This is actually a skill-based competency, and when we started actually making the timeline, I felt we should leave it a little open because we don't know how each and every institute will function. That is the reason why I thought we'll leave it to the end and make a decision. In the morning, as I was going through the competencies, of course, all of us have realized this, and then I realized that there's a lot of overlap. So I have sent on the CBME biochemistry group whatever is the overlap, and altered a few of the competencies, which each person will be looking at, or which each group will be looking at, or will be responsible for. So, with the result, group 1 will be responsible for 11.1, 11.2, 11.16, and 19, because um, that is because there's this overlap, in the competencies. And then we're not sort of reinventing the wheel. And I'm sure as we teach, or as we demonstrate to the students, we will also be, putting it all together or combining it. That's the reason why this seems to be the best kind of a situation, because this is the way we are going to teach those competencies as well. We are not going to say that because it is 16 we will say repeat the same thing in the end. We will take it with 11.2 as well. So with that, I have already sent you who is going to do what on the CBME group. So please have a look at it. So on Friday, we have about 4 competencies to be covered. I would like to really thank my group, because, and especially Dr. Anita Devnath, who, just today in the morning put these slides together, and I think she's done a wonderful job. So thank you. This is what I call, I feel that this is team spirit, because no one waited for anyone, and people just selflessly worked. And someone said that, okay, I'll do the presenting, and then we thought in our group that someone who has not presented should now open up. So that is how we've, in spite of the hard work done by X, someone else has just been given the baton over. So that is the way it should be. You have to be magnanimous and let people take over and let people learn. So with that, this is my group: Anita Bijur, Anita Devnath, Akila, Afreen, Ankita, Anuva, Afzal, Amrita, and Anandita. All of them have worked all throughout this, except for, I don't know, I've not seen Afzal much, but anyway, but whatever it is, everyone's worked very hard throughout this whole 3-month sessions. So with that, I would like to invite Amrita to take over, right? Amrita?
Yeah, thank you, ma'am. Thank you very much. Though I'm presenting the second time in this group, but I've learned a lot, and thanks, ma'am, for giving me the honor of presenting today as well. So I will be speaking. Here it is not written the competency 11 BI 11.2, but it is given added in the later on of the slides. So in 11.1, describe commonly used laboratory apparatus and equipments, good safe laboratory practice, and waste disposal. PI 11.16, observe use of commonly used equipments, techniques in biochemistry laboratory, including pH meter. And BI 11.19, outline the basic principles involved in functioning of instruments commonly used in biochemistry laboratory and their applications. Please, the slide, ma'am. Next slide.
Yes.
Now, BI 11.1 describe commonly used laboratory apparatus and equipments, good safe laboratory practice, and waste disposal. By the end of the session, students should be able to identify along with their uses of the following lab apparatus: test tube and centrifuge tube, measuring cylinders, flask, that is round bottom, conical Erlenmeyer volumetric pipettes, glass transfer, graduated pass-through and micropipette, burette, beaker, funnel, petri dish, cuvettes, test tube holder, test tube rack, spatula, Bunsen burner, tripod stand with wire mesh, glass rod stirrer, wash bottle, dispenser, polyneutrube, and vortex mixture. And they should also learn to handle them with care, how to maintain the glassware and plasticware, like cleaning, rinsing, and identify inadequate rinsing. Ma'am, next. BI 11.1 also includes identify along with their uses of the following lab equipments like ion selective electrode, pH meter, water bath, colorimeter, spectrophotometer, H-Bax albuminometer, electrophoresis chamber, chromatography chamber. Handle carefully the concentrated acids, alkalis, boiling liquids, chemicals, Bunsen burner, pipettes, and dispense various solutions, including acids and alkalis, how they should do it. And they should identify infectious from non-infectious waste and discard them accordingly in appropriate color-coded bins with colored liners. The teaching learning method is around demonstration with instructions. Time allotted is 2 hours and assessment method is by spotters and MCQ. I think now the slides will be presented by Akila ma'am.
Yes.
Ma'am?
Yeah, hello.
Okay.
Yeah, Akila. This slide is yours.
Thank you, Amrita. Yeah, okay. I'll be presenting the other competencies. 11.16. Observe use of commonly used equipments and techniques in biochemistry laboratory, including the pH meter. And 11.19, outline the basic principles involved in the functioning of the instruments commonly used in a biochemistry laboratory and their applications. So by the end of these sessions, the student should be able to identify the following lab equipments, at least the centrifuge, the pH meter, the ABG analyzer, automated or integrated analyzers, the semi-automated analyzers like the ELISA reader, the electrolyte analyzer, and the PCR. Explain the principle and applications of photometry, potentiometry, the electrophoresis, chromatography, PCR, centrifugation, ELISA, and chemiluminescence. And the teaching learning method for this would be a demonstration with instructions. The time allotted would be 2 hours, and the assessment would be with either spotters or MCQs. Kevin? Yeah. The next competence 11.2 describe the preparation of buffers and estimation of pH. By the end of this session, the student should be able to plan the preparation of buffers that are commonly used in the lab, like phosphate buffer, barbitone buffer, tris buffer, and citrate buffer. Explain the applications of most commonly used buffers. Determine the pH of the buffer by indicators, pH meter, and pH paper. Understand and operate the pH meter along with the use of standard pH solutions for calibration, and understand the handling and maintenance of the pH meter. Again, here the teaching learning methodology would be demonstration with instructions. The time allotted is 2 hours, and the assessment would be mainly MCQ based.
Yeah, that's it.
Okay. Yeah.
So thank you so much. Group 1 is done. I think group 2, would you like the slides to be shared, or where is group 2?
Ma'am, can I know the names for the group 2?
Group, 1 minute. I'll just put these slides up. So at least group 2 is it Nibriti, madam? For group 2, unmute Dr. Arindam. Please unmute Dr. Arindam.
Okay, ma'am. Yeah.
Okay,
Dr.
am I
Arindam.
audible?
Yeah, Dr. Arindam. Yeah.
Yeah.
You can share your slides. Yeah.
No, ma'am. There is no slide actually, so I'll
Okay,
be
very
narrating.
nice. Very nice. Just talk then. Yeah. Thank you.
Okay, ma'am. So this point, the students already know about the basic lab instrument and lab safe laboratory practices from 11.1 and 11.2, and they also know about the pH meter. So that will help us regarding competence 11.4 and 11.20. That has one physical characteristic, that is the pH of urine. Anyway, we first see competency 11.3. It says describe the chemical components of normal urine. Now there is only chemical components, not physical. So we have prepared 3 SLOs from that. Enlist the chemical constituents of normal urine. As a corollary, classify chemical constituents of normal urine in 2 groups, organic and inorganic constituents, accurately. And describe the clinical significance of chemical constituents of normal urine, as in any diseases that is related to an abnormality of the normal ingredients. So this pretty much covers up the competency number 11.3. It's all about normal urine. So teaching learning method is a DOAP session of 1 hour, and the practical assessment is via OSPI or Viva VOC. Moving on to the big one, that is 11.4, which has been clubbed with 11.20, which says, and it's the previous one was knowledge competency, this one is a performance one, and thus it's one of the certifiable procedural skill, both 11.4 and 11.20. It says perform urine analysis to estimate and determine normal and abnormal constituents. So there's a I need the opinion of the house at the end. So what can or cannot be done over here, because it's actually huge. So let me start by enumerating my SLOs. Describe the procedure for collection of random and 24-hour urine sample correctly. Record all physical characteristic of normal and abnormal urine, mainly those 7 physical characteristics. Those are volume, color, appearance, odor, specific gravity, any solid impurity, and pH. So pH, since they already know how to use a pH meter, they can use that pH meter or using litmus paper. That's up to them. Next, demonstrate the steps for measuring specific gravity using urinometer independently under direct observation. Ma'am, this we have been doing it for a lot of time, so I've included it over here. It can be omitted as the house decides. Next, since the competency dictates us to determine all the normal constituents of urine also, so it says to determine all the things that are not abnormal. So I have made the competency SLOs like that: detect the presence of inorganic sulfate in a given urine sample referring to the test protocol independently or direct observation. So like this, ma'am, inorganic sulfate, chloride, calcium, phosphorus, ammonia, creatinine, uric acid, hippuric acid, and ethereal sulfate, all of them ideally should be the student should be able to do that, because these are all normal constituents of urine, and it's a certifiable procedural skill, and the competency says both detect both normal and abnormal constituent of urine. This is followed by the ones that are routinely done in all other medical colleges: to detect the presence of reducing sugar in a given urine sample using Benedict's test, estimate the reducing sugar semi-quantitatively in a given urine sample using Benedict's test, detect the presence of urinary protein in a given urine sample using Heller's test or sulfur salicylic acid test, and heat coagulation test. Next, at the end of the session, the first year MBBS student should be able to detect the presence of blood in a given urine sample using benzidine orthotoluidine test as the scenario suits. Next, to detect the presence of bile salts in a given urine sample using Hayes sulfur test. To detect the presence of bile pigments in a given urine sample using Fouchet's test. To detect the presence of acetone and acetoacetic acid in a given urine sample using Rothera's test. Next, I have given a few more SLOs using urinary sticks or dipsticks. So demonstrate the detection of pH and specific gravity of a given urine sample using urine dipsticks. Next, detect the presence of protein, glucose, blood, bile salt, bile pigment, and ketone bodies in given urine sample using urine dipstick. Those were the first were chemicals test, and this one is dipstick. And the last two, in which they need to the full panel prepare a full urine report of a given urine sample referring to the standard format of urine report independently under expert observation. And lastly, interpret the full urine report and correlate the findings with clinical condition of metabolic disorders. Now, since it's a clinical interpretation, the level will be knows how and shows how, because they are doing hands-on in the OSPE, and the assessment can be via practical and MCQ spotter, and there are many things that can be done. So that's it, ma'am, for 11.3, 11.4 along with 11.20.
So in this case, there is no need for any of the urinary estimations, right? Quantitative estimations. All this involves all
No, ma'am.
qualitative.
Yes, ma'am. Quantitative, I think there's a colorimetry based 11.6, so where the quantitative estimations can be done.
Yeah, where creatinine clearance in that.
Right, ma'am.
Yeah?
Right.
Okay. All right. So I was just trying to clarify. Yeah. Thank you so much. Now I think group 3 has already emailed Dr. Bedi the slides, and you will have to unmute and allow Dr. Priya to
Okay, ma'am. Now I
share.
am muting myself. Thank you. This is Dr. Arina.
Yeah, thank you, Dr. Arindam. That was good. And now we need to have Dr. Priya's screen to be shared. Group 3. I will have to.
Priya is unmuted, and I've made her the presenter, ma'am.
I have shared my slides with Dr. Bedi sir. Is it there?
Ma'am, Dr. Bedi has not shared it with me, ma'am. Should I ask, ma'am?
Do you have the
So
slides?
1
Priya?
minute, ma'am.
Yeah.
Yeah, I have, ma'am. 1 minute. Is this can it be seen? Is
Yes.
it possible?
Yes.
Is seen, ma'am?
Yes, it is.
Okay. Okay.
Very nice.
So this is
Now
with the.
make it.
Okay. Good evening, all. This is with the group 3 practical competency. That is.
Can you just make it
Yes, ma'am. Yes, ma'am. Yes, ma'am. Yes, ma'am. Yes.
Yeah. Yes. Thank you.
So this is with the group 3 practical competency, that is B1 11.5 and B1 11.6. Myself, Dr. Hilda Priya, will be doing the presentation. So competency B1 11.5, we have the competency that is to describe the screening of urine for inborn errors and to describe the use of paper chromatography. So the specific learning objectives of B1 11.5. At the end of the session, students should be able to enumerate the urine screening test for inborn errors of metabolism, identify the urine screening test for inborn errors of metabolism as positive or negative and interpret the findings, describe the principle and use of paper chromatography. So interpret the given paper and TLC of amino acids accurately. Observe the paper chromatography and TLC of amino acids using the standard amino acid mixtures and urine samples and their applications. Should be also able to interpret the given lab reports of screening tests for inborn errors of metabolism. So with the competency B1 11.6, describe the principles of colorimetry. So under this, at the end of the session, students should be able to describe the principle of photoelectric colorimeter, spectrophotometer, and the applications of Beer-Lambert's law. Should be able to describe the parts of photoelectric colorimeter using a label diagram. Should be able to explain the differences between a colorimeter and spectrophotometer. So the competency number B1 11.5, the estimated teaching hours is 1 hour, but the teaching learning methods are lecture, demonstrate, and lab report interpreting. Assessment methods could be written and Viva OC. It can be integrated with general medicine. So the B1 11.6, again, the estimated teaching hours is 1 hour. So the teaching learning methods are lectures, small group discussions, and can demonstrate with instructions. And assessment methods are again small essay questions and Viva OC. So there is no integration with it. Thank you, ma'am.
Is there anyone who wants to comment on this? I think everything was very clear, and thank you, Priya, for that. Now
Thank you, ma'am.
Ma'am, this
Yes.
is Dr. Anita Bijuria.
Yeah.
Just one the query, ma'am. The integration with for the IEM better than the general medicine wouldn't not be neonatology or pediatrics.
Pediatrics. Yes.
Yeah, that's what, ma'am.
Yeah,
Even I
for
got
the
that
IEM rather than
doubt.
general medicine.
Yeah,
Agreed,
even
agreed.
I had that doubt. I too had that doubt, but that's what it has been suggested. Looked like that, so I don't know. I would welcome any suggestions from the group.
No. I think pediatrics would be better. And I mean, we can let medicine be, but then we can have medicine and pediatrics both.
Okay, ma'am.
Yeah, that is better. Thank you. Thank you for pointing that out, Anita.
Thank you, ma'am. Thank you.
So
Thank
now
you,
we
ma'am.
have Dr. Sugati, Group 4. And she will please share your slides, Dr. Sugati. Can someone please, allow Dr. Sugati to share her slides, please? Dr. Bedi?
Ma'am?
Dr. Sugati, you have to unmute and you have to let her share her slides.
Yes, ma'am. Yes.
Madam, Dr. Suganti does not have slide only. I think she's going to talk.
Very nice. Okay. Okay. Then just let this remain. Let this screen remain. And Dr. Suganti, you can talk now.
And Dr. Sugandhi is self-muted, ma'am. Please, and yeah.
Good evening, all, ma'am. Sorry, I didn't prepare any slide. Anyway, our group is
No, sorry.
BI
No, sorry.
11.7.
That's fine. We didn't want you to prepare slides. I mean, it's okay. Even if you don't prepare slides, it's absolutely fine.
Okay, ma'am. Thank you. Because I was in another emergency in the lab, I didn't prepare after coming home. Sorry. I think BI 11.7 demonstrate the estimation of serum creatinine and creatinine clearance. The domain is skill and level is performance, core competency, and it's a practical, and we need to certify it once. 11.8 is demonstrate estimation of serum protein, albumin, and Ag ratio. Almost domain level, core, everything is same, and also this also need to be certified once. So normally in our college, ma'am, we are 150 students and we are divided into 50 batches. So what we do is, let me go on with 11.7, and there is also overlapping of this 11.7 with 11.22, 21 and 22. This is also already put in the slide by Dr. Arindam. So what we do is 2 hour session. The first 10 minutes, we clearly give the objectives like for creatinine estimation, to estimate and the creatinine in the given sample. Method is Jaffe's method, endpoint method. Then measurement of creatinine clearance. So that is the calculation is taught in the first. So creatinine clearance is kept for the next class, but we do tell that the same principle for estimating. So we give the introduction for 10 minutes and we keep the tubes, everything ready and demonstrate it in front of 50 students only. Then since there is a step of preparation of protein-free filtrate, that is explained to them because we directly give an protein-free filtrate to the students. So our once this 10 minutes introduction is over, they are divided into 25 students and 30 minutes each student will be in the practical hall and 10 minutes buffering for each batch is given. So by that time they have to complete the doing the experiment. And here since we are using the borosel pipettes, provided the pipette syringe, students usually find it difficult. So that in estimation serum practical and estimation in the next practical. So they become practice for it. So next, once this is over, almost 1 hour 40 minutes would have gone. So next 20 minutes we'll keep for the discussion part, where the details of significance of estimation of creatinine is discussed and clinical clearance. What is the use of estimating the creatinine clearance is also taught. And the next practical class, we go for the creatinine clearance estimation. So we give them a 24 hours urine sample. Usually we don't provide the urine sample. We keep it in the container for them to measure. But we give a serum, ask them to use the same serum creatinine what was estimated in the last class. But for the urine, we give a fresh sample. So they will estimate the creatinine in the urine sample, use the formula of UV by P, and they go for the calculation. Here the important thing is, we once they finish it off, we again discuss what is the importance of creatinine clearance estimation, also the estimated clearance, and what are the formulas available for it, what are the CKD guidelines, plus the creatinine coefficient because it has got a clinical significance. Coming to the next 11.8 competency, almost it's the same. We use biuret method only, ma'am. And during the biuret method estimation, so that usually we used to take the total protein estimation first, because that is one of the easier method. You need to have 5 ml of reagent and the sample standard, so that is very easier for the students to get skilled in their hand. So usually we take them the biuret test first, and then the second practical, we need to have 2 practical hours. Albumin is taken in the next class, then they will do the AG calculation. So this is what we do. Albumin is done by the kit method here, BCG bromoprazole green method, whereas biuret we do by the calorimetric endpoint method. And since we have a part of like case history given for cirrhotic patients, in the total protein estimation class only we give a case history of cirrhotic patient. With that 10 minutes introduction will be given for how to estimate the total protein. Then in the similar way batches are divided. They go for 30 minutes practical class and come back, and the discussion is done. So the second class albumin estimation is just a 1 minute incubation time. So class, practical hours will finish off very early. So we keep the discussion part in the albumin estimation in the next class, AG ratio, and little bit of plasma proteins also. Thank you, madam. Only thing here, we need to certify. We were not able to do this time, madam. We just corrected the record, and whoever has filled up, so they will, it is like taken for granted, like they are certified. So that buffering time 10 minutes we have given is, those people will be slow, they would have got erroneously or did mistakenly, those people will be followed and made them to complete. So our practical is between 11 to 1, 11 a.m. to 1 p.m. So those people might extend to stay. That's what.
Yeah, that makes sense.
Thank you, ma'am.
So is there anyone who would like to make any comment? Thank you so much, Suganti.
Thank you, ma'am.
Madam, would I like ask you whether can we certify it later? First we teach them And after that, once more they can perform it and we can certify it that time.
Yes, yes, I think that's a good idea, because even in that certificate that has been given to us,
Yeah,
there is like this times normally you would have expect them to do it. So the
yeah,
final
but we give them,
certification, whether there is a remedial requirement or not, and the final certification should be later on.
yeah, because you can give them a checklist, put it up beforehand, and then they can see according to the checklist, on these basis they would be marked, so that they know how to go about it. That's what we followed in our institute.
Yes, yes.
Madam,
And then
can I
make
add?
sure they get graded as 4 to 5. So if they get, see, out of 5 they get 4, I think they are passed. So that is how you can do it. And then if it is less than that, they need to have a remedial one. That's how we planned out.
Okay,
Uh,
very nice.
Madam,
Has everyone are people listening to this? This is a good
Madam, can
idea.
I have one
Everyone
more?
will do the same.
Uh,
It does.
Madam, one more thing. We have our formative assessment, no, madam. The
Yes.
thing is, like, we keep 2 estimations, so the same estimation will not done by the same student. So that can be taken as one of their certifying in consideration. But usually go by the lot. So initially for the first second practical only this estimation comes, ma'am. Formative assessment in between we keep. So we usually put together total protein, albumin, and glucose. This is what we do in our. So only thing it comes in lot. So that period of certification can it is accepted for formality, that can also be added.
Okay. Oh, so you suggest that when they do it but formative assessment, you think that they will do the same thing again? They will be given
Yes,
it.
ma'am. Yes, ma'am. They will be given the practice, but only thing is they will not be doing all the 3. They will
But
get a chance of any one.
can I
Oh,
interrupt?
That,
Because when it
yes,
was
yes.
skill assessment, it was not to be considered for formative assessment. I think skills had to be,
uh,
they had to be skill. I mean, you have to have a certificate for that skill, and then that could be used for a formative assessment. That's what I think it is like that. That's what.
I just want a clarification here. So the once certified only they can go for the formative assessment. That's what you mean, no, madam?
Yeah, because it has to be entered in the logbook that it has been
Great.
certified.
Mm. Okay. So
That's what I take on it. Madam Dandekar, madam, you can.
Yes, yes. That
Yeah, because
it is better that way.
huh,
Of course, it's each institution, and I mean, it's debatable, but always better that you do it beforehand, as you know. Yeah.
mm. Thank
So
you,
should
ma'am.
we
Thank
go?
you for giving.
Should we go ahead with 5? Dr. Neelam Pawar, does she have slides?
Yes,
yes,
ma'am.
madam, she has.
Okay. So then, can you please? There she is. Yeah, you've been made presenter. Please share your screen.
My slides are visible now, ma'am.
Yes, 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 they are present.
Okay.
I
So
can't see your
I'm
slides.
Dr. Neelam.
I can't see your slides. Yeah, now I saw them. Yeah, now I can see
Okay.
them.
Okay. I'm Dr. Neelam, and I'll be presenting on behalf of Group 5 the competencies of Biochemistry 11.9 and 11.10. So basically 11.9, it includes demonstration of estimation of serum total cholesterol as well as HDL cholesterol. And for 11.10, it's demonstrating the estimation of triglycerides. So both of them have skill assessments, but there is no certification. As such, there is no specific SLO. We have like what is expected of the students for semi-auto analyzers, because both of these will be done for semi-auto analyzers.
So they need to, they'll be expected to, in the exam, know principle. The procedure, we don't expect them to memorize, that will be given to them. They just need to know how to add what is required. And calculation, reference range, clinical significance, and whatever OD values are given, how to put it in the formula and calculate, they have to know, and especially in the exam. So for us, the faculty, there will be grading. So like for example, if we take total cholesterol only for one session, so usually a session of 2 hours will give instruction for around 15 to 20 minutes, and then they will go on to perform the experiment. So suppose this is one of the principles by which it is being done. We have to make sure that the principle correlates with what kit we are taking from the distributor. Based on that, the principle has to be given, and procedure calculation also depends upon what kits we are procuring. So in the practical manual as such, we keep the reference range and clinical significance short. Like for quick reading, we give them like a paragraph or maybe like 3-4 sentences of, like for example here, hypercholesterolemia risk and causes of hypercholesterolemia. But but if they come for the exam, then questions can go towards the theory side. So anything can be asked, whichever part it comes in the theory part. So this is something that was that is being done for the coming batch. We could not do this for the current batch. What we did was, after they went and did the experiment, even when they were doing the procedure, they were not completely doing it by themselves. There was always someone to guide them, to make sure that the reagents were added correctly, and the instrument operation was, students never handled it. It was done by somebody from the department. So what they did was, after they added the reagents, and the instrument was handled by somebody from the department, and they used to be given the OD values, and they have to come back and calculate and report the values. And if there is some more calculation, they have to do that, and they are expected to know the significance of what experiment they have done. So we would just correct the record books and ask them some questions, and then they would be gone. So, but for the next batch, this is what is being proposed, wherein they have to exactly the part where they are doing it may not be regarded as a skill, because there is someone who is making sure that they do it correctly. But maybe the part where they are calculating and they are answering the viva and everything, that can be taken as a skill. And based on how much percentage they are able to do it correctly, answer correctly, that can be categorized into below expectation, meets expectation, and exceeds expectation. So feedback can be given, and with signature. And if it is very bad, like below expectation, maybe they'll have to do some more attempts. So this is again another example. The HDL cholesterol can be done in another separate session, and the same way the procedure calculation has to be as per what kit we have procured. And for quick reading, some reference ranges and clinical significance, and also non-HDL cholesterol. Too much is not being dealt in the practicals, because they have a separate SUT session. So here we try to concentrate so that we give them time to do it, rather than spend too much time on instructions. And same way, similar grading attempts. Even in case of triglycerides, like for example, if this is a principle, the procedure calculation, it will be given to them, and they have to calculate. So this is what is. So basically, assessments will include, of course, when we are trying to grade them according to their attempts, we'll give them some score, but in the exam, mainly they need to know the principal calculation and how to put the OD values into the calculation and give a result with units and also a significance. And the Viva can include even in the questions from the theory part. And there can be some elements of this practical that can be asked in spotters or response stations. It can be combined, like it need not be purely practical. So the similar competencies related to theory part can be all mixed and given. It can even spill over to cases like all of these formulas and all, they can be asked. So that's all from me. Thank you.
Thank you so much. One thing I would like to, I think, bring to everyone's notice here is, when they are doing quantitative estimations as students, I personally feel that they should never be compared. The value should never be compared, numerically, because ultimately, I don't think these are the students who will actually be, carrying out the test. And even if they are carrying out the test, their marks should not be cut because they are not sort of matching the expert readings, etc. I hope everyone agrees with this. I don't know what is everyone's take on it.
Yeah, that can be done without, they should not be compared because they are not going to do. But fairly, they should know how to use generally what is how to use a handle a pipette. That is what basically at least they should know. And a proper OD, a comparative, I mean, calculation part they should know, and they should be able to interpret the results. That is very important. The basic sample interpretation, they should be, whatever readings they have got, they should be able to interpret that results also.
Yeah,
Whether
true,
it is
true.
the range, whether
Yeah,
it's
so
above
that is why I'm always afraid, when you say more than 70% and all, like, I hope the actual comparison and the comparison of the values, it does not, play a large chunk of those marks.
Ma'am, this is Dr. Anita Bijur again. Can I come in?
Yeah, of course.
Ma'am, because I find most of these methods now, they want us to, do it using the semi-automated methods, or even sometimes, automated, triglycerides, HDL cholesterol. Usually they are very time-consuming manual methods. So most of us go by the semi-automated methods using kits. So what skill are we expected to, to kind of, teach the students or expect them to develop? What skill, ma'am? Apart from interpretation, yes, I fully agree. Give the values and, but I don't know why, these things.
If dilution, if you need a protein-free filtrate, how they are making a protein-free filtrate, all these are things that need to be looked at and watched. And also how they are, whether they're taking exactly, the 0.1 ml or whatever that is required, and they're using the right autopipette. Or all that can be looked at. And obviously, if the results go really, really haywire, that means they've really done something wrong. I mean, that's the one way of saying. I mean, everything will not fit into when the values don't conform to the expert readings drastically, then there's something wrong with their procedure also, na? So some amount of skill. So you will notice that a lot of the skills are now sort of removed. Is it not? We just have a handful of quantitative estimations now in this so maybe they don't want us to teach them too much of estimations.
Yeah, okay. Yeah, got it, madam. Got it.
Yeah.
Thank you.
Yeah, thank you. So now over to Dr. Pradnya Rao. She will be presenting on behalf of Group 6. And can Dr. Bedi, I forget you, who is helping Dr. Bedi?
Ma'am, this is Neha, and I have unmuted Dr. Pragya.
Yeah, yeah.
Okay.
Neha,
Hello,
do me
can
a
you hear
favor.
me?
Just has Dr. Pradnya Rao, do you have slides? Pradnya?
Yeah, I can hear you, Sucheta. Can you hear me?
Yes, madam, we can hear you.
Yeah.
Okay.
Do you have slides?
No, I don't have slides, and I apologize. We don't have
Okay,
anyone
then
from
should I
group 6.
show my slide?
You have the slides, then
Neha,
please go ahead.
can you let me share my
Sure,
screen?
sure, sure,
So
sure. Please
at
go ahead.
least those competencies are seen.
Yes, yes, please go ahead.
Yeah. I'm sorry, it's not a very my slides are not. I just
No,
picked
no,
it up.
it's fine. So I
Yeah.
just wanted to put across my
Sorry.
thoughts. Then I will open the floor to anyone who wants to pitch in. So this is BI 11.11, demonstrate the estimation of calcium and phosphorus, and BI 11.12, demonstrate the estimation of serum bilirubin. And just a few minutes ago, I think Dr. Anita raised a very pertinent question. And all the others who presented so far, who have been using semi-auto analyzers, it makes sense because that is the least time consuming and the cheapest way to do things. But now I'm faced with another dilemma when I say when I hear demonstrate the estimation of, and therefore it's a very what do you demonstrate really? You just have to see somebody pipetting, which the students already know, and then it goes into a black box of the semi-auto analyzer, and then the reading pops up. So this is something which they already know. So I'm really wondering what it is that they expect the student to see when such things are demonstrated. Again, I go back to what Dr. Anita said, that yes, it's probably what they want the student to learn is the way in which the values will be interpreted. So what are the reference ranges, how they will be interpreted, maybe give a small case scenario with the value and then ask what it can be done. There's another thing that I'm just thinking of where probably various practicals or experiments results can be combined in one way. For example, estimation of serum bilirubin can be combined with the total protein and what will follow next, SGOT, SGPT, etc. And then you have a liver function test case report. So there's an integration of various practicals which are being done, and that in turn can be used for interpretation. So it's probably just shows, so it's not even much more than that. So once again, I think all that will come is the principle. Procedure might be given, but only to let them know what the major reagents are which are involved. Once again, the calculation will be displayed, and the reference values will be given along with the clinical correlation. So I would be interested to see how it would be marked, because obviously the students are just seeing it. So would assessment occur? I really don't know. So it would be very interesting for me to hear from the other college people what exactly they're doing. Thank you.
Thank you, Pradnya. Yes, for that thought-provoking idea. I do agree that there is a lot of ambiguity here, and maybe the word demonstrate here is. I mean, whether we really need to, they would, of course, be doing the estimation, and yes, what will they do with that? With the with the values coming out of the black box, as you rightly said. So, what are the
Absolutely.
takes? Yeah. What do the other people feel? But it will, I think, Pradnya, this will come back to the original what we used to make them do, right? But of course, they will not be. And then, another thing is we don't allow the students to even aspirate, right?
Correct. Absolutely.
Because there will be someone sitting there and he will sort of give them the values.
Right. So it's really something which, it can be thought of in a little more, detailed way. Why should we use the word demonstrate the estimation of? Is there something else which the student can do in the same time, something which is more valuable to the student? So I'm just wondering if there are any thoughts. I'd like to hear it.
But a few other practicals, one or two, they can actually do them the way we used to do it in the, by the
Correct. By the
using a colorimeter, because
Yes.
ultimately the use of a colorimeter is there. So when we say use of a colorimeter, somewhere we will teach them the Beer-Lambert's law, right?
Correct.
Yeah.
That's the total project is the best way to do that.
Depending on the situation and the convenience, all practicals need not be put onto the semi-auto.
Correct.
We can have at least 3 or 4 practicals. We can have them actually do the practicals, with a test and a control and all those 4 tubes. So that will also give them an idea as to what is actually happening in the machine.
Yeah, makes sense.
Madam, can I come to the picture?
Yes.
See, when we talk about the apparatus part of it, we are talking about centrifuge tubes also. So,
we are talking about
centrifuge.
Centrifuge. You had seen the first thing.
Yeah.
Your one that put centrifuge tube also as a part, I think, of the apparatus. Tubes, whatever it was, no? Different tubes, fallen wood tubes and all that. So somewhere they should know what is a centrifuge tube, what is how a centrifugation is taking place. So some amount of practical they can have it, and remaining can be interpreted. You can give them reports and they can interpret it.
Yeah. So, I feel these estimations like calcium, phosphorus, bilirubin, they can easily do without the semi-auto. But people like the lipid profile, cholesterol, TGs, etc., TG, HDL, they can do using the kit method.
Even
And what
even
would
glucose.
be the assessment pattern? How would you kind of check whether the student has learnt it? Because it's only shows. So I doubt whether we can do anything more than ask them for the reference value and also the interpretation of the values.
Yeah. And we will give them one quantitative estimation, no?
Yeah, no, this is demonstrate the estimation.
No question. We have one quantitative estimation.
I think like we are not demonstrating, they are demonstrating to us.
Is that so?
Yes.
Yes, ma'am. That's the competition.
It's not like we have to demonstrate, the student has to demonstrate the estimation of calcium.
Oh, then it comes to the same thing. Then it will be just like cholesterol and HDL, etc.
Yeah. No, so cholesterol and all, because it's more convenient for us to use the kit. We could use that. And calcium, phosphorus, bilirubin, SGOT, PT, we actually make them do like our old times.
So that means it would really take, there's a lot more quantitative estimation in this practical set than it was in the older one, in the pre-CBME one.
I missed that. I couldn't hear you properly.
I think there are more practicals for estimation of biomolecules and enzymes and all in the CBME curriculum as compared to the pre-CBME one.
No.
Madam, we had all these practicals.
We had all these.
Oh, okay.
Yeah, we had all these.
Also, but it is not here.
In fact, even alkaline
CSF,
phosphatase is there. Everything is there. Glucose is there. Only I'm just wondering why glucose was, clubbed like that, way below that.
Yeah.
That is really a misnomer. But anyway, the fact that it appeared is thank God.
Okay.
So this is this we wanted to finish up to group 6 today. because then the next Friday, the Friday 25th will be, I think, our last session. So is there anyone who wants to say anything or comment? We have about 56 people here with us. Thank you everyone for being here. Is there anyone who wants to comment or have their thoughts?
Yeah, ma'am. This
Ma'am,
is again
again,
Dr.
Yeah, Arindam, please.
Yeah, ma'am. Ma'am, one thing regarding 11.4, the detection of the normal constituents of urine, in which a student is supposed to detect all those inorganic sulfate, chloride, everything, calcium, ammonia. So that thing can also be done by autoanalyzer, right? I mean, and also, so will they be doing everything hands-on? So how much is the utility? Just I'm thinking about that. It's like
No.
these
See, in
things.
this case,
Yeah.
we're at this level. We're not talking about the utility. We are talking
Okay.
about bringing and making the students understand the concept of micromole, of milliliter, liter.
Okay.
Because even when they are, thinking of water volume in the body or anything, people are not able to understand the volumes.
Okay.
And the concept of volumes is not there. So this is to help them to understand all these aspects. It is a fact,
Okay.
but then that will go for all most of the subjects. Where are they going to do so much in when they do pathology also? They are not going to do
Right.
everything unless they become pathologists. But all
Right.
this is just sort of form the ground level. That is
Okay.
the reason why
Because
quite
even they go back and they come back for elective in the subject of biochemistry, then they might
correct.
find it more interesting for since.
Correct. And they will also
Oh,
understand. No, then they will maybe go and use the auto analyzer. But they
right.
already know what is happening in the auto analyzer. That is the
Right.
hope.
Okay, ma'am. Okay, ma'am. Thanks a lot.
Thank you, Arindam, for that. Anyone else?
Madam, this Dr. Meghna wants to be unmuted and Dr. Nibriti madam also wants to be unmuted.
Okay. Neha, can
Ma'am, I
you
have
unmute
unmuted Dr.
Dr.
Meghna.
Madam and who else?
Dr. Nibriti madam wants to be unmuted. She had written before. She
Yeah,
wants to give comment.
Dr. Nibriti, Neha.
Ma'am, Dr. Meghna is unmuted. She's just self-muted. She can talk. Ma'am, I'm doing Dr. Navriti.
Okay. Dr. Meghna, will you
Hello.
please unmute yourself?
Good evening, madam. Excellent presentation by all the presenters. And I just wanted to add that as Dr. Dandekar madam correctly said that tomorrow they will be Indian medical like graduates and they may not come to biochemistry pathology. So we could emphasize what are the pre-analytical and analytical or post-analytical errors can happen during estimation of these analytes, like for especially for lipid profile if fasting is not there, or
Okay.
even
I totally agree with you, and also in that quality control part, in the
analyzer
later
that
on
is
in
the
the
machine is not working properly. If there are
competency,
any
that part will
errors
come.
in the machine, if it's not proper, then also the result is going to affect, because the more we take them to automation, then they won't know the actual principle and what are the various minute steps where the test can go wrong. And for triglyceride and HDL, we have used the kit and calorimeter. Costly compared to semi-automated, but still we can use triglyceride and HDL kits. We have used the kits of TG and HDL as well as cholesterol, so they can be very well done by calorimetrically, and you can emphasize that where the steps can go wrong, and then like you don't blame lab every time for wrong result when you become intern or you become a resident, that there may be some pre-analytical and analytical factors or post-analytical factors that are related to any estimation.
Agreed. And all this will come under quality control in that 11.16, I think.
Yeah.
So all that will be done. I think Dr. Nibriti Das is also unmuted. Dr. Nibriti, would you like to say something?
Yeah, I had couple of suggestions, but quite a few of them had been already covered. One thing which I wanted to lab safety and precautions and the sources of hazard, there should be some SLO in the starting practicals because that is important. And
Yes,
then
agree.
the procedural SLOs, how to use a colorimeter, blank, control, and for everything, centrifuge, measurement, as Sucheta rightly said.
Yes, I agree. I agree with that. So thank you, Dr. Nibriti, for that suggestion, and it will all be a part of the QC, the quality control. And I hope the group, I don't know which group is going to do the quality control part. They should include all this, the random errors, all this, all these aspects, at least the definition and what is expected. You know, pre-analytical, analytical, post-analytical errors, QC, precision, accuracy, all this will become, and then of course the Levy-Jennings chart and the Westgard rules. So just a small brief of all this should be included in that QC component.
Madam,
Anything
do they
else
have
that
to
anyone else wants to say?
errors?
Ma'am, Dr. Nagalakshmi has raised hand. Please unmute yourself, ma'am.
Good evening, ma'am. Can you, am I audible, ma'am?
Yes, you are.
Okay. Ma'am, my doubt is regarding the competency 11.4, which said estimate and detect the constituent of normal urine. So,
Yes.
are we really estimating the constituents in normal urine? Are we?
That is precisely what I had asked Arindam also.
Okay.
So I think in a few cases, no, wherever estimations are available, we can just tell the students about it. But it is up to each university to decide. So if you think that there is no need to estimate and you just do a qualitative analysis, that is also fine.
Fine.
Yeah,
Okay,
and
ma'am.
then you should also, sort of, I'm sure when the external comes, you can always say that this is what we have done.
Yes, ma'am. Yes, ma'am.
I,
And
yeah, but then you
one
should
more
always
thing, ma'am.
tell the students that that in urine you are able to even quantitate these parameters.
Constituents. Yes, yes, ma'am. Yes,
Yeah.
ma'am. Uh, one more thing, ma'am, regarding 11.6, regarding the estimation of calcium and phosphorus. Like, if possible, we can get a serum sample and make the student estimate calcium and phosphorus. And if we get an abnormal sample, basically we can even show them the reciprocal relationship between the uh, calcium and phosphorus levels also, if possible.
Yes, very much. That can be done.
So we can
And that is what
practically
we've been doing.
demonstrate
We've
them.
been doing that with our students always.
Yes, ma'am. Like if we get a case of hypocalcemia or something, so that
Yeah.
serum can be put in and then we can ask them to do, and then
No,
they can also.
we have also stopped using serum. We only we sort of give an artificial sample and we call it serum because nowadays with all the problems and the infections, susceptibility to infections and all, we've long stopped using serum as such.
Okay. In that case, maybe artificially itself we can prepare
You
the
can,
solution with high calcium and low phosphorus, and then demonstrate the reciprocal relation.
absolutely, that's the way it has to be done now.
Yes, ma'am. Thank you, ma'am.
Yeah, great. Anyone would like to say anything more? Thank you everyone for this active participation. I'm really happy. It's already 8:40. We've spent a good 1 hour discussing this. So if there's nothing that anyone else wants to say, should we call it a night?
Ma'am, there is one more hand raised. Dr. Debasis Basu, he is unmuted.
Yeah, Dr. Debasi Basu.
Yes,
Dr.
ma'am.
Basu.
Dr. Debasis Basu.
Okay, Dr. Basu, you're unmuted. Would you like to say something? Unmute yourself. Dr. Basu?
Dr. Basu, please unmute yourself. You're just self-muted. Ma'am, I think he's not able to do that.
Try again, Dr. Basu.
Oh, hi, Dr. Bedi.
Hi.
Neha has been helping us quite a bit.
Yes. Am I audible, madam? Hello.
Yes, Dr. Basu, you are. Dr. Basu, you are.
Hello. Yes, madam, I have a concern which you have just addressed. Now, what is the sample lab on which we are going to perform all these tests? What is the sample? Is it because 100 students or 200 students or 250? It is a considerable amount. Now, what is the sample? Because if we use serum, that is, I think, it is a very risky proposal. And in my experience, we as a biochemist, we do not perform the tests. Even after we have been qualified by biochemistry, what is practical, it is the technicians who do it. And the technicians, they have been performing it. Madam, may I complete my concept? Now, if we use the technicians who perform them, they are experienced and they know how to protect themselves. They are specifically trained for it for a quite a long time. They are even vaccinated for, say, hepatitis B, etc., etc. Now, students, they are novice. Just they have passed the 12th grade, some may be a bit higher, and they have not yet been exposed to the seriousness of these serum. They have got no idea about the serum seriousness of these contamination. Now, if we expose them to sample, I think it is absolutely dangerous. Even if a single student be affected, who is going to take the responsibility? Now, since we have come together, we should decide that what should be the material on which tests to be done. Is it we should take non-human samples, non-human serum, or take
Sir, you can just use
other
artificial
vehicle.
sample. You can just make an artificial sample just as you use for standard calcium or phosphorus or anything. And for bilirubin, we use
Yes,
methyl
artificial
red.
sample.
We use
Artificial sample from.
methyl red.
Okay, is that acceptable to all? Is this dictum followed by everybody else?
We have stopped giving serum samples a long time ago to us.
I very much appreciate your idea, and that is you have just heard it. But that should be dictum, and that should be followed by everybody. I think that should be declared that no human samples should be allowed. I think just a single institution or a single college
we have never allowed our students to actually put it, sample with high bilirubin levels.
Do all
that would have been absolutely dangerous. So we have always made artificial samples. Always made artificial samples.
So I think it should be declared. I think it should be a declaration from this forum that no institutions do not allow students to handle serum. This should be declared as a thumb rule. I think since we are from through India, so many participants have come together. I think that needs an awareness, and that needs to be propagated. If it is possible from
methyl red for serum bilirubin, use methyl red. Yes. It works absolutely fine.
There are methyl red is same, but for cholesterol. What to do of cholesterol? Methylate is for bilirubin. What to do of cholesterol? What to do of HDL? Glucose, okay, we can dilute glucose in water and give it. But say enzymes, what to do? How to estimate enzymes? Bilirubin is, we can substitute methyl red for bilirubin. But what about enzymes? What to do about enzymes? How to approach in a kinetic test? These, I think these issues may be raised and sorted out from opinion from all the participants should be asked for, and a decision, if it can be made at this forum, that will be a help for everybody else. That is my
And
take.
always, where for enzyme estimation, we should always take care that you give them autopipette. They are not pipetting.
No, okay. Pipette is all right. But what about the sample? When with a pipette there can be a contamination, because it is not possible to specifically look after a batch of 50 to 60 students. There are at best 2 or 3 tutors or demonstration, or 4 to 5 mentors. It is not possible for 4 or 5 mentors to look after the whole batch, and they are not specifically trained for it. This is a serious concern. Even a single student is affected.
Okay,
That is
sir. Yes,
terrible.
your point is well taken, and we can always debate on the CBME biochemistry group. Okay, please put this under
Madam, my
CBME
request
biochemistry
is to
group,
please.
and people will opine. Yeah. Thank you so
Yes.
much. Thank you. Thank you.
Okay. Thank you, madam.
Is there anyone else who would like to say something, or should we close this? Dr. Nibriti? Can Dr. Nibriti be unmuted?
Can I make a comment?
Dr. Nibriti, would you like to say something? Okay, I think we've lost her. All right, then, if there's nothing more that has to be said, we can say a good night. Yes? Thank you so much. Thank you, Neha. Thank you, Dr. Bedi. Good night. Let's meet on Friday, which will be our last day of this group.
Now I'm unmuted. Once everything is
Okay,
over.
okay. So, Dr.
I have
Nibriti, would you like to have the last word?
I have given all my
Thank you, then.
in the
Thank you so much. Bye-bye, everyone.
Thank you, ma'am. Thank you, ma'am.
Thank you.